Hi, I wanted to create this video as an overview of what pain is and how it can affect your ACL rehab, as well as the goals and rules regarding pain as you go through your ACL rehab. The first thing to note is that pain is a unique and multifaceted thing, where it is not as simple as external stimuli leads to structural damage, leads to pain, leads to you must stop what you're doing because you are damaging yourself. There's a whole host of both physical, emotional, and mental things that affect your pain experience, and that can be unique to everyone. I want to be clear that the goal of progressing through ACL rehab is not to treat, manage, or to absolve you of pain. Of course, we never want you to end up with pain, but the reality is that you had a surgery to fix whatever structural abnormality or issue you had. Of course, the trauma of the injury and the subsequent trauma of the surgery can lead to experiences such as pain. Henceforth, after you've had the surgery though, all of the structural abnormalities have been fixed. And almost any type of pain you have there can be traced back to some sort of load management issue. More often than not, it is something that you're doing something that your body or your knee is not ready to handle. This is not necessarily always a bad thing. And in general, levels of pain that are less than 3 to 4 out of 10 and go away immediately after an activity and do not linger or affect your function later on is okay, particularly if it doesn't feel to you like a dangerous pain that tells you need to immediately stop. In general, the types of pain people experience are anterior pain, posterior pain, and an achy joint soreness type of pain. So I'll go through those individually. Anterior pain can come from a variety of things. The first thing we often think of is with a patella tendon graft. Some anterior pain is to be expected. We always want to follow those rules of 3 to 4 out of 10. Because of this pain, sometimes people have gotten away from doing open chain knee extensions. That will lead to subsequent more pain because you will have quadriceps atrophy, which prevents you from protecting both that tendon and that kneecap as you do things. If you want to improve your function, you must improve your strength. And if you have low levels of pain as you're improving your strength, that is an acceptable thing because the juice is worth the squeeze, so to speak, as we're moving you through this. And as long as your function is improving, low levels of pain are okay. The way to improve a tendon and to build a more stronger and robust tendon is actually by putting a load through it. Of course, there's a right amount of load to put through it, and you want to make sure that you're doing that and not overloading it. Hence those rules of 3 to 4 out of 10, no worse after, does not affect your function. In particular, what I found is that people who have pain with open chain knee extensions at their patella tendon or at their kneecap are generally focusing on the motion of thrusting and kicking their foot out rather than focusing on squeezing their quadriceps and activating it to move the weight or perform whatever activity they're doing. Focusing on utilizing your quad and actually activating it will help with that activation and will take some stress off both your kneecap and your tendon. The second type of anterior knee pain is patellofemoral pain. That is just a fancy way of saying kneecap pain. It is not a medical diagnosis, or it's just become a garbage pail medical diagnosis where we say anyone whose kneecap hurts has patellofemoral pain. The most common cause of this after ACL surgery is because you lose quadricep strength from the trauma of the surgery and the trauma of the injury, causing a neuromuscular cascade which inhibits your ability to fire your quad. This leads to increased joint contact forces over a smaller area at your kneecap, which can lead to pain. The best way to improve that is improving your quad strength and your quad activation, which will in turn actually increase the surface contact forces, thus decreasing the stress you experience at your kneecap. Did you get all that? Either way, the focus is that, or the moral of the story is that improving your quad strength will increase or decrease the amount of stress on your kneecap and thus decrease your pain over time. The key is finding the right amount of load to allow you to not have so much pain that it limits you, but to be able to build up your quads to allow you to get back to a point where you're able to do higher level functional things. The other types of anterior knee pain include pain at your joint line, which is just below or on the outsides of your kneecap. This can be an indication of overloading and more akin to soreness, which we'll talk about later. Finally, you can also have issues with your fat pad, or what we call fat pad impingement. This is right along that patella tendon and can be the result of overusing your leg, walking too much, and doing things before you have full extension or before you have enough quad strength. That type of pain is usually more of a sharp, take your breath away pain, and the kind we really want to avoid and even don't want to push into or let go as much as other types of pain. So that fat pad impingement is something that is more intermittent, more sharp, and something that we don't want to really tolerate, and happens usually when you're going into full extension with your knee. Moving on from anterior knee pain, I'll next talk about posterior pain. In my experience, posterior pain is most often the result of a few of the muscular structures behind your knee. We're looking at your popliteus, your calves, and your hamstrings. Surprisingly, your calves cross over your knee, cross over the back of your knee, and your hamstrings and that popliteus muscle, which is a small muscle, also crosses over behind your knee. These can often get irritated, again, when you don't have enough quad strength, and often when people are trying to do quad sets or trying to move themselves into full extension, they use their hamstrings and their calves to pull themselves into that position. That's not the way those muscles are made to fire, and it can often lead to pain and spasms. Another way I've seen this happen is when people are using the hamstring curl machine and they don't allow their hamstrings to do the work, but rather they try with everything they can and flex their foot up towards their shin and try and use their calf to help out. So one thing to try if you're having pain using that machine is to relax your foot and lighten the load and just focus on using that hamstring muscle. For all of these things, whether you're having pain with knee extensions, hamstring curls, or anything else, the answer is very often managing the load properly. So making sure that you're using the muscle that the exercise is intended to work, and making sure that you are using a load that you can tolerate and handle, and gradually progress the amount of load that you're able to handle. If you're having swelling behind your knee, that is a different thing and more concerning. And if you have a pocket of fluid back there, that's when we start to worry about something called a Baker's cyst. But that is usually not something that presents as pain, but more as swelling, and always something you want to make your doctor aware of. Finally, the last type of pain, and the most common and the most okay type of pain, is what we call joint soreness. Joint soreness generally presents itself as a feeling of a deep ache. Sometimes it can be in that anterior area in the front of your knee where we talk about that joint line. But most often it feels deep, it feels achy, and it just feels like my knee feels blah. What that often is a result of your knee telling you that you are doing more than the knee joint is ready to handle. That often comes as a result of you not having the strength to do the load that you are currently doing. It often goes along with swelling too. So very often when we're progressing you off of the crutches, progressing you to jumping, running, or if you're progressing back to work when you're on your feet a lot, the things that we'll monitor are your joint soreness as well as your swelling. We want to make sure that we're not in the habit of increasing that joint soreness regularly and leaving it where it's staying that way for days. We expect to have sometimes some joint soreness as we progress your load. And very often what we'll do with that joint soreness is we'll keep the load at the same level to allow you to adapt. But if it becomes something where your soreness is lasting more than a day or so, and your swelling is lasting more than a day or so, that's your body's way of telling us, hey, we need to dial this load back, whether it's something you're doing in your personal life with walking, working, etc., or if it's something that we're doing in the program in terms of the loads you're using on weight-bearing type machines. That's generally the problem, is something weight-bearing is too much for your knee joint to handle. I hope this overview was helpful for you to understand. that pain is never the focus of our ACL rehab, but the focus is how we can progress your strength and the loads you're able to tolerate so that you're able to do all the things you want to without pain that prevents you from functioning in that capacity. Good luck.